Hello guys, welcome to session 5. In last session we have discussed about the protozoan diseases like malaria. So in this session we'll continue that protozoan disease. So that is amoebiasis. Okay. After that we're going to be focusing on the Ascariasis diseases like Ascariasis, Filariasis and one of the fungal disease that is a ringworm. So this is all going to discuss in these sessions. In this slide, we're going to discussing about the one of the protozoan disease that is a amoebiasis. So we are also calling as a amoebic dysentery. The causative organism is a Entamoeba histolytica. Okay, so it is found in the large intestine of human beings. Yes, how it is going to be transmitted? It is transmitted to healthy person by the drinking and eating of the contaminated food and water. Okay, if you drinking or eating the food from the unhygiene conditions or from the footpath or in the roadside, what happens? So this kind of disease it may transmitted to healthy persons. Okay, now what are the symptoms? Symptoms is like constipations. So constipation means there is no regular bowel movement, or we can in simply words we can define as, so it is a exactly opposite to the loose motions. Here the patient's not able to frequently throw the wastes from his body, or he is struggling to throw the wastes. So that conditions we are calling as a constipations. Next one is abdominal pain. So nothing but is we can consider stomach pain and cramps. So cramps means the person's feeling like a twisting of the muscles, right? So stools, or we can call as fecal matter. So the fecal matter consists of mucus or blood clots. Okay, so these are the symptoms of the amoebiasis. Yes, last part of this, that is a control and preventive measures. How going to be controlled? So if you maintain the hygiene conditions, or if you drink or eat from the good hygiene conditions, and there is a proper wash of the fruits and vegetables when you will bring from the markets. So after that thoroughly wash we have to use. So like this we can control this kind of diseases. In this slide we're going to discussing about the Ascariasis diseases. So here the causative organism is a Ascariasis disease. Now those organism causes disease, and that diseases we are calling as a Ascariasis diseases. So here, so we are going to discussing about the Ascariasis disease. Next slide we are going to discussing about the Filariasis disease. So there are two diseases are mentioned in the Ascariasis diseases. So we're going to focusing on the first disease, that is a Ascariasis. Okay. So this Ascariasis, it is a causative organism is a Ascaris lumbricoides. So it is commonly found in the intestine, or it is one of the intestinal parasite. So this Ascaris we are also calling as a roundworms. Okay, we are discussing about Ascariasis disease. It is caused by the Ascaris lumbricoides. It is intestinal parasite. Then next part, it is a mode of transmission. How it is going to be transmitted from one person to other person, especially from infected to healthy persons. Okay, so it is because of the contaminated waters, vegetables, fruits and etc. Okay, if you eat the contaminated fruits, vegetables or other food items, from that it will transmit it to healthy person, or even though from the drinking of the contaminated water it may transmit it to healthy person. Okay, so next one is the symptoms. symptoms. The what are the symptoms, right? So symptoms is like fever, vomiting, okay, so abdominal pain, so nothing but we can consider as stomach pains, fatigue, so tiredness will be there. Next one is it is anemia. So anemia means the RBC numbers as get reduces, and that conditions we are calling as anemia. So there is a weight loss. Yes, why it is a weight loss means, so it is affecting to where? It is affecting to intestine. The if intestine get disturbed or it is get infected means it is not able to absorb the food. So what happens automatically? So the persons are facing the weight loss. So there will be chances of internal bleeding. Okay, so it may heavily damage to the intestine. From that part the blood may comes, so that is occurring as internal bleeding. And these worms may be found in the stool or in the fecal matters. Okay, so we are discussing about Ascariasis. The causative organism is Ascaris lumbricoides. Okay, so control and preventive measures. So it can be controlled by good hygiene conditions, preventing the drinking and eating of the contaminated foods. So whenever you bring the fruits, vegetables from the outside, it should be thoroughly washed. After that we have to utilize. So by these methods, if we follow, we can control the this Ascaris disease transmissions. Okay. In this slide, we're going to discuss one more disease of Ascariasis. It is a Filariasis or elephantiasis. Yes, in our surrounding and in our community, we find that some are the persons who are having his legs are enlarged, and it looks like a elephant legs. Okay, and those disease we are calling as a elephantiasis or filariasis. Now, why this disease is causes or how disease happens means, it is because of the organism is it is a Vacheria branchofti and Brugai malai. Because of this Ascariasis species, it may cause that elephantiasis disease or filariasis diseases. Okay. Now exactly what happens here means, especially our limbs, our hands and some genital area enormously become enlarged. Okay, why it is become enlarged? Because of heavily their lymphatic system will get damaged. Once if it is enlarged, once if it is swollen or inflamed, that normal structure it cannot be reformed. Okay, when it get damaged, it goes on swelling, and finally how it looks like? It looks like a elephant leg. So based on that, they name kept as it is a elephantiasis disease. The causative organism is it is a Vacheria branchofti and Brugai malai. Now how this disease is going to be transmitted? So this disease is transmitted from one person to other person. It is because of biting of the mosquito. It is a Culex and Aedes species. Okay, so here mosquito acting as a vector. It will responsible transmission of diseases from one person to other persons. Okay. Now, what are the symptoms is, right? The symptoms is like headache. The persons may undergo mental depression. Fever will be there. Okay, as you know that there will be the huge inflammation in the limbs, genital areas, and it may be large in the swelling in case of our hands. Okay, so here there will be the blockage of lymphatic vessels. So here this organism is going to be heavily damaging our lymphatic systems. Okay, so later what happens? So because of this, so the infection goes on, and this goes on heavily damaging to the lymphatic system. So later what happens? Our organs are become enlarged. Once if it is get enlarged, it is not come back to its original state. Okay, so this is all symptoms of the Filariasis. As we know that it is caused by Vacheria branchofti and Brugamilli. Now we are calling as elephant. Why we are calling it elephant? Because of the person's legs, hands. It is looks like a it looks like a elephant legs, and it is a heavily swollen or inflamed. Okay. How it is transmitted? It is transmitted because of the culex and Aedes mosquitoes, right? Okay, the control and preventive measures of this filariasis disease or elephantiasis disease. So in last session, we discussed about the malaria. We know that how the malaria will be transmitted. It is because of what? It is because of mosquitoes. So this elephantiasis or filariasis, it is also transmitted by what? It is also transmitted by because of the mosquito. If you control the mosquito population, we can control these diseases. Okay, so first point, so waste like plastic bottles, pots, small ditches, drain off. Okay, so if the plastic bottles are there, or small ditches, ponds and pools are there, so we have to be remove the all water from those areas, because we know that the mosquito larvae will be develop in that particular areas, and they become the house for the development of mosquito larva. If you remove the water from that, so we can prevent the development of mosquito larvae. If it is the places are too large to unable to drain off, so we have to be use some pesticides, kerosene oil on that to remove the or to kill the mosquitoes larvae. If it is ditches and ponds, pools are more larger, we are not able to remove the water, so in those areas we have to introduce the larvicidal fishes, okay, like gambusia. Then we have to maintain the good hygiene conditions, proper sanitizing areas in our surrounding areas. So like this we can prevent the development of mosquitoes. Okay, whenever we go for outside in the evening for parties and other things, the hands and feet should be covered, entirely to be covered, and we can use the creams like odomas. It's acting as a mosquito or insect repellent, and we have to be sleep under the mosquito net. So if we follow all these conditions, we can prevent them, or you can control this especially this filariasis diseases, or we can control the biting of the mosquito. Suppose if it is infected, so that time in the early condition we have to take the drugs to kill this this one of the Ascariasis, that is a bacteria. So normally these medicines are, or these drugs are provided from the government. So drugs like DEC. So DEC means it is a diethyl carbamazine. So these are drugs are used to kill these organisms. Okay, so we have to follow this, and we can control and we can prevent these diseases. Yes, in this slide, we're going to focusing on the fungal disease. So disease caused by the fungal species. The organism it is a fungal or fungi. Okay. So one disease we're going to discuss here, that is a ringworm, also calling as a tinea, right? So the rings shaped or circular scaly patches of the skin by the infection of some fungi is called ringworm. Okay, so it is caused by the fungi, like it looks like a ring shape or circular scaly patches on our body or on the skin. Okay, and this disease we are calling as a ringworm, and it is one of the most common infectious disease in the man. Okay, the causative organism is or pathogen is, it is a fungal species, we know that in fungal species like Mycosporum, Trichophyton and Epidermophyton. Okay, so these are the species are responsible for the disease, that is ringworm or circular scaly patches, right? So how this get transmitted? Okay, how is get going to be infecting? So ringworms are acquired from the contact with the soil. So from which place it will come? It will come from the soil, or already the person is infected whose towels, clothes or combs if you use, so from that it will transmit to the our bodies. Okay, how it is going to infect? It may come from soil, or already the persons who are suffering from ringworm, whose things like towels, clothes, combs if you use, so that infection will be transmitted to healthy one. Okay, now what are the symptoms? The symptoms is like appearance of dry, scaly lesions. So lesions, or we can call it lesion, on various parts of the body such as face, mask, foot, groin, scalp and nails. Okay, so there is a ring like patches, dry, or here lesion means here it is a somewhat we can call as damage on the skins. Okay, it is looks like a circular patches on the which part you can find on the faces, we can find on neck regions, in the foot regions and groin. So groin means it is a found the area between the two legs. So it is found between the joint of our lower limbs, and that part we are calling as a groin. In the scalp, okay, so head part, so that is we are calling as a scalp. Okay, and in the nails, so in this part we can find a circular patchy like structures. Okay, so there is a intense itching. Okay, there is a continuously the skin become dry, and it will give the immense or intense itching. We can feel that heat, and there is a moisture content. Okay, we can feel that in the particular part, which part is irritating or itching, that particular part we can feel that heat and moistures. Okay, and that helps to thrive the skin folds, such those in the groin or between the toes, especially where it will be the more intense, and we can feel more, especially groin. So already we know that the groin means, so in the we have legs, so the joint of the legs, that part we are calling as a groin. So we can call, simply we can understand, or near genital areas. Okay, or it in between the toes we can find the ring like or patchy like structures. Yes, how going to be controlled? Prevention control means if you maintain the hygiene conditions, regular baths. Okay, if you avoid the use of the towels, clothes, or avoiding the combs, we can control the transmission of this ringworm disease. Okay, so last part in this session, so that is a homework. So questions like, first one, explain the mode of transmission of Ascariasis. Second question, draw the structure of Entamoeba histolytica life cycle. Third question, write a note on control and preventive measures of vector-borne disease. So it is one of the quite common questions raised in the examination. Okay, so write a note on control and preventive measures of vector-borne diseases. Next question, name the causative organism of ringworm. Next question, name a variety of fishes that can be recommended to control mosquito larvae in ponds. Okay, so this is all about the session 5. In next session, we're going to discuss with the next part. Okay, thank you.